students, my name is Niyati Said and thanks for watching Edupedia Word videos. My topic for the presentation is the 10th section of the chapter Excretion and Osmoregulation, or excretory products and their elimination. In this section of presentation, we'll be studying about the disorders of excretory system. First is uremia. Uremia means the accumulation of urea in blood, which may lead to kidney failure. Kidney failure is also known as renal failure. Renal failure is also known as renal inefficiency. The term kidney failure describes a condition in which kidneys fail to filter toxins and waste products adequately due to decrease in glomerular filtration rate. And what are the causes for the renal efficiency? You can say that any accident or injury that interrupts blood supply to kidney for a longer time. Diabetes mellitus is also a cause of renal failure. And third, you can say excessive use of painkillers such as ibuprofen and paracetamol. And long term of hypertension can also cause kidney failure. And please note that renal failure is of two types, which are those acute kidney injury and chronic kidney disease. The type can be medically determined by trend in serum creatinine, anemia, and kidney size, which is determined by ultrasound sonography. Okay, and now comes renal calculi. Okay. Renal calculi. What is renal calculi? Renal means kidney and calculi means pebbles or stones. So it is a stone or insoluble mass of crystallized salts such as oxalate, which is formed within the kidney. If we say its definition, then a kidney stone is also known as renal calculus, is a solid crystal aggregation which is formed in the kidneys from dietary minerals in the urine. And if we talk about their location, then they are found typically in the kidneys, ureters, or urinary bladder. When stones are in kidney, the condition is known as nephrolithiasis. When stones are in ureter, the condition is called as ureterolithiasis. And when stones are in entire urinary tract, including kidney, then that is known as urolithiasis. Now, if we talk about composition, then the most common type of kidney stones are those of calcium oxalate, which is followed by calcium phosphate. However, though less common, kidney stones are also composed of cysteine, uric acid, and ammonium magnesium phosphate. The kidney stones are made up of ammonium magnesium phosphate. They are also called as Electrolyte. Okay. Now coming on to Glomerular Nephritis, then you can say that this is a condition when the glomerulus gets inflamed. Okay. So there are three disorders of the excretory system. See, this is the image of renal calculi. That renal calculi means, renal means kidney and calculi means pebbles. Okay, so this is a kidney stone which is also known as renal calculus. It is a solid crystal aggregation which is formed in the kidneys from dietary minerals in the urine. Okay, and this renal calculi, they are found typically in kidneys, ureters, or urinary bladder. When stones are in kidney, the condition is called as nephrolithiasis. When stones are in ureter, then the condition is known as ureterolithiasis. And when stones are in entire urinary tract, including kidney, then that is known as urolithiasis. Okay. See, increased incidence of renal calculi is seen in males over age 40. What are the symptoms? Symptoms are nausea and vomiting. Okay. So you can say that renal calculi may lead to nausea, vomiting, fever, blood, and pus in the urine, and the painful urination. Okay. Now what are the causes? See, the dietary factors that increase the risk of stone formation are low fluid intake, high dietary intake of animal protein, sugar, sodium, oxalate, and apple juices or cola drinks. And you may feel sharp and sudden severe pain, may be intermittent depending on the stone movement. And what are the diagnosis? Diagnosis can be done by UA, crystoscopy, IVP, renal stone analysis, and by the serum detection, in which calcium and oxalate or uric acid concentration is detected in serum. So this is how this renal calculi can be detected. Okay. Now comes glomerular nephritis, which is the third disorder of kidney, in which glomerular apparatus gets inflamed. Okay. So this is glomerulus, which I have already taught you. So you can refer my previous presentation. This is normal glomerular structure. It has this lining, okay, which we call it as Bowman's capsule. Okay, and this red blood cells are inside it. Mesangial cells are also there. Endothelial cells are also there, and podocytes are also there, surrounding the membrane of the Bowman's capsule. And then this is the condition of acute glomerulonephritis, in which red blood cells, that is RBC, proteins, and white blood cells, they escape out capillaries. They just escape out. So, and appearance of white blood cells is also seen here in the acute glomerulonephritis. Okay, and as you can see that these mesangial cells are in normal quantity in normal glomerular structure, but here the proliferation of mesangial cells is also seen, and in which red blood cells, protein, or white blood cell, they escape out capillaries. Okay, now comes chronic glomerulonephritis, in which the accumulation of antibody antigen complexes is seen. Okay, see, this is the antigen and antibody complex, and this gets accumulated just in the surrounding of this membrane. In this condition, the inflammation of basement membrane is seen in chronic glomerulonephritis. Okay, and these are trapped waste. Waste also gets trapped. As you can see in this normal glomerular structure, it is not trapped, but in this case the waste is trapped here, and appearance of white blood cells are also seen in the chronic glomerular nephritis condition. Okay, now coming on to hemodialysis. Hemodialysis in patients with uremia. Okay, urea is removed by hemodialysis. Hem means blood, dia means through, and lysis means loosening, and dialysis, you can say it is dissolution. So hem means blood, and dia means through, and lysis means loosening. So entire dialysis means dissolution. It is the process of treatment by which excess urea is removed from the blood of a patient suffering from renal failure, where the blood urea level increases abnormally, and the condition is called as uremia. Okay. See, what happens in this condition is blood is taken out from an artery of a patient. See, this blood is taken out, okay, from the artery of the patient, and then it is cooled at 0 degrees Celsius and mixed with an anticoagulant. Anticoagulant, what does it do? It prevents the blood from being coagulated. So anticoagulant such as heparin is added to the blood which is taken out by the artery from the patient, okay, and it is then pumped into artificial kidney. This is artificial kidney, where the blood flows through channels or tubes bounded by cellophane membrane. Okay. This cellophane membrane is permeable to small molecules such as urea, uric acid, creatinine, but it is impermeable to plasma proteins. The tubes or the channels, they are immersed in dialysing fluid. That means in this apparatus, dialysing fluid is filled, okay, and in which tubes are there, okay. So the tubes or the channels, they are immersed in the dialysing fluid, which contains some small molecules and ions but no nitrogenous compounds. The nitrogenous waste, they diffuse out from the blood into the dialysing fluid, and this process of removal of micromolecule is called as dialysis. The blood coming out of the kidney is warmed to body temperature, okay, because the blood will also come out, right? See, this blood is coming out from this dialysis unit and it is injected into the persons. Before inserting this blood into patient, the blood should be warmed to body temperature and it is mixed with antiheparin to restore its coagulability. That means when it goes inside the patient's body, then it will have the capability of coagulation, and it is injected into the vein of patient. See, blood was taken out from the artery, but the blood is filled into the vein. Okay, please note that. And now comes the question, what's the significance of hemodialysis? So it is primarily used in patients with acute kidney injury and chronic kidney diseases, which is considered as stage 5. Stage 5 is the end stage of kidney disease, as artificial replacement for lost kidney function. And another significance of hemodialysis is that it can be used as holding measure until kidney transplant is performed, or sometimes as the only supportive measures in those for whom transplant is not possible. However, hemodialysis is imperfect treatment as it replaces only excretory function of kidney and not endocrine function such as production of erythropoietin, calcitriol, and erythropoietin. As we know that erythropoietin, it helps in RBC production, and calcitriol helps in bone formation. So this hemodialysis is imperfect treatment because it replaces only the excretory function of kidney and it cannot perform the endocrine function such as production of erythropoietin and calcitriol. What does erythropoietin do? Erythropoietin, it helps in RBC production, and calcitriol, it helps in bone formation. Okay, so it is an imperfect treatment, you can say. See, this is what I have just taught you, that how it goes. The blood is taken out from the artery of the patient. It has to go through the blood pump then, and blood in the tubing flows through dialysis fluid. These are the channels, and this is the hemodialysis machine, and these are the channels or the tubes inside the hemodialysis machine, and it is filled with the hemodialysis fluid. Okay, and this is how it through the cellophane membrane it allows the passage of the molecule based on the concentration gradient, and then the blood is warmed to the body temperature, and then it is injected into the veins of the, see, this is the vein, so it is injected to the veins of the patient, okay, by adding the antiheparin to it so that it can restore its coagulability. Okay, so what is dialysis? The kidneys are the pair of organs, each about the size of a fist, which is located on either side of your spine, and they are responsible for purifying your blood by removing waste and excess fluid from your body. When the kidneys don't work properly, dialysis is used to perform the function of kidney, and dialysis is a treatment that filters and purifies the blood using a machine. This helps keep your body in balance when the kidneys can't do their job. And dialysis has been used since 1940s to treat people with kidney problems. So now comes the renal failure, which I have already taught you that it is a partial or the total inability of kidneys to carry an excretion and salt. Water and regulatory function is called as renal failure. Okay, so the kidney failures leads to uremia. Okay, uremia is a condition where there is excess of urea and other nitrogenous waste in the blood, and kidney failure also leads to salt water imbalance. Okay, and kidney failure may also lead to stoppage of secretion of erythropoietin, which I have already taught you, and which stimulates the formation of RBCs. Okay, so kidney failure causes are tubular injury, infection, bacterial toxins, inflammation of glomeruli, drug reaction, hemorrhage, and arterial or venous obstructions, and fluid and electrolyte depletion. So these are the causes of the kidney failure. And what is the prevention measure? That proper maintenance of the normal fluid balance, blood volume and blood pressure can help prevent renal failure. Okay, now comes the kidney transplantation. Kidney transplantation or renal transplantation is the organ transplant of kidneys into a patient with the end stage renal disease. Now, what is the type of kidney transplantation? It is typically classified as deceased donor transplantation or the living donor transplantation. And it is the ultimate method in the correction of the acute renal failure. A functioning kidney is taken from the donor. The person that donates its kidney is known as donor. So the functioning kidney is taken from a donor, and it is better to receive kidney from a close relative to minimize chances of rejection by immune system of host. Kidney transplant is a surgical procedure to place a kidney from a live or deceased donor into the person whose kidney no longer function properly. See, this is the donor's kidney which is transplanted to the patient's body, and this is how it is placed. Okay, see, this is the deceased kidney, and below it donor's kidney is placed. Okay, so, and this is done after matching the compatibility between donors and recipient. The transplant is performed, then only the transplant is performed, and in most cases barely functioning existing kidneys are not removed. As you can see the deceased functioning of the kidney is not removed, and therefore the new kidney is usually placed in the location different from the original kidney. It is often necessary to use different blood supply, and see, this donor's kidney has to be normal blood supply, right? So the renal artery of the kidney branching from the abdominal aorta in the donor is connected to the external iliac and iliac artery, and the renal vein of the donor's kidney, which previously drains blood into inferior vena cava, is connected to the external iliac vein. But don't get deep into it. Just know it that the deceased kidneys are not taken out from the body, but the new kidney is usually placed in the location different from the original kidney. Okay, and this is how kidney transplantation takes place. So this was all about the chapter excretion and osmoregulation. Thank you, and keep watching Wikipedia word videos.